Thank you for coming. I wouldn't be here today, and I wouldn't have come before many years ago if it wasn't for Ivona Swedborg. Ivona first came and worked with us many years ago, and then we came back here and worked with Ivona, and I'm so proud to have done that with our family as well. So I lived here. My wife speaks moderately good Swedish because she is Dutch, and she was trying to teach me today how to say 7 seasick sailors went to a hospital, you know, and you know how to say that and I don't. So today is about just giving you a little bit about what you need to be asking for, what you need to be doing, the information you need to know about yourself to get the best outcomes for your treatment. Super important. And I was listening to Helena talking about exercise and breathing and about clearing the chest and the tummy. And I can't emphasize how important that is. That's something you all need to do before you do anything in terms of treatment. You need to breathe, and breathe well and breathe better. That's one of our big problems. Sitting here today, we're not breathing properly. The fluid is accumulating in our legs and our arms right now, and we can show that with our equipment. Okay, so even now, you should be every now and then putting your arms up and having a nice big stretch, tightening your muscles in your arms and breathing in deeply, and then exhale. Yeah, that's it. And do it a couple of times, because the first time it doesn't do much. The second and third times it starts to do a lot more. After you've done that, if you've got a leg lymphedema problem, what you do is you wriggle your legs gently. And you know, it's not going to work as well if you've got tight underwear on. And we're going to talk about that as well later on. So I've been talking about that this morning with all the people over in the conference about tight underwear and tight bras. So one of the things I would like you to do tonight is go home and have a look at your bra in the mirror. Okay, and have a look at your underwear in the mirror and see if it's actually causing compression on your legs or on your arms. That may not be the best for you in that case in terms of arm lymphedema or breast lymphedema or leg lymphedema. So sometimes simple things make the biggest difference. So this is how sometimes our patients feel. There's nowhere to go for treatment. There's nothing else I can do. I've reached a dead end. When in fact you may not be at a dead end. You're there because you don't have enough information, you don't have good enough knowledge. And today is about giving you more knowledge so you can find your way out of that roadway. You can find a way around the blockage. And knowledge and education is absolutely crucial in this respect. What I'm going to talk about today is about the way in which you and your therapist can make measurements of your limb. And how you can see how is it going. Is it the same? Is it getting better? Is it getting worse? And what part is getting better? What's worse? What's the same? That's important for you to know, because sometimes you may not realize things are getting better, but it doesn't seem like it. So that's what measurement is about. Measurement allows us to then target the treatment to the problem that we've seen or we've found. So that's what today's session's about. And the most important words here are the ones in yellow, okay? A good outcome depends on good knowledge, okay? You have to know about your arm or your leg or whatever else. You don't have to focus your life around it. In fact, you mustn't focus your life around it, but what you must do is know about it. When you know it, it's not an enemy anymore. It's not a foe. It's something that's part of your life that has to be dealt with. Like every morning I brush my teeth. Okay, most mornings I have a shower. I've got to do it. It's part of my life. And if we happen to have something that's not so good with our body, then we have to make it part of our life, but not our life. Our life doesn't revolve around brushing my teeth or having a shower, but it's part of it. So that's what today is about measurement and doing that thing. Now you see in this picture here, we have to think with the lymphatic system holistically, and this is what Helena was talking about earlier. You know, all the fluid from our feet down here drains up to our left shoulder. Okay, so it's got a long pathway to go. All the fluid from my right arm drains into a different area. It drains into an area just here. So there's a little bit of difference between how the right arm and the right side of the head behaves compared with the rest of the body. Our legs, our tummy, our chest, and our left arm and our left side of the head. They're two different drainage pathways. And sometimes by knowing that and by thinking about that, we can get a better outcome. Which means sometimes some of you might have a swelling of the foot down here, but it's nothing to do with down here. It may be something to do with right up here. That's why we have to think big picture. We must think holistically when we're dealing with the lymphatic system. And that's why we were doing the breathing first, because it's making the biggest difference in here, and it can help you pull the fluids up like Helena showed you when she was sucking that water up. Okay, that's really, really important in lymphatics. Simple things can make the biggest difference, but you have to know and you have to measure them to see how they're working. One of the other very important things about the lymphatic system is that our whole body is divided up into different areas. They're like the different counties in Sweden. You know, you have different states. You have Skåne, however you say it, and you have Uppsala and all those other places, you know, whatever. And in Australia we have different states. And these states are separated by boundaries. And the same happens with your lymphatic system. There is different boundaries. There are different states. Sometimes one is a problem and the other one not a problem. And that's what I want you to think about and recognize. And we'll look at those later on. The problem areas most often is when... Oops, don't stand on that. Sorry. I'll take it home. Sometimes the biggest problems are the problems here on this inner side of the upper arm, the inner side of the leg. That's where the problems first show themselves, and that's where you have to learn to recognize them as early as you possibly can. So that's why knowing about these lymphatic drainage areas is very, very important for you. So everyone clear with that? We've got different areas. Sometimes one will be swollen, sometimes they'll all be swollen, and that's what we have to recognize. The other most important thing, if we look at our legs here, and I just want you to think about this, the most important are these 3 points here. We've got in our legs what's called most major bottlenecks. We've got them in our arms as well. And that's here at the elbow, here in the armpit, and here in the wrist. But in our legs, we've got bottlenecks right here. All the lymph vessels come together in this area here. This doesn't look too good on the camera, I know. Okay, they come together here, and what happens if you've got tight underwear here? You don't get good fluid drainage, so you have to be careful. Another bottleneck is here in the knee. So if you've got some knee problems, if you've got a sore knee, arthritis, or something with your knee, that causes problems of drainage of fluid from your feet. And another bottleneck is right down here, around the ankle. So you don't want too much pressure in those areas, because the fluids are not going to drain from those areas. So just be careful of bottlenecks. The other most important thing is a lot of our lymph vessels are normally closely associated with our blood vessels. So if there's something going wrong with our blood vessels, something may happen to our lymph vessels. So you've got to take care of your blood vessels, your blood system, your blood pressure, how your blood is draining. And we'll talk about that in a minute. The last most important point here is this one. We're going to move this out of the way. You have to put the fluid into the lymphatic system for it to work. If you don't put the fluid in, nothing's going to happen. So the first thing we have to do is load the system. If you want to take water away from your house, you have to put it into a bucket or into a pipeline. The same happens with the lymphatic system. Unless the fluid goes in it, nothing's going to happen. So you have to load it. And the way in which we load the system is via movement, via changing the muscle tension. And I'd like everyone to do that just now. Just change your muscles. Move one arm and feel the muscles moving with the other arm. Just feel them. They're all moving. Every time you can feel that movement, you're loading the lymphatic system. And I can also do the movement by holding my arms like this, and I'm squeezing my muscles now, but I'm not moving. I'm just squeezing and relaxing my muscles without moving my hands. That's also loading the lymphatic system and pumping it. And that sort of thing is important. You've got to load the system, okay? If not, nothing happens. The fluid just sits around. Some people may have come across a term called oedema. Who knows edema? Edema is different from lymphedema. Edema is a consequence of there being too much load on a system which is normal. And maybe the most common cause of edema that you might know is high blood pressure. Or something else has happened to your kidneys, or something has happened to your liver or something. That's different from lymphedema. Lymphedema is when you've had your lymphatic system damaged or destroyed by radiotherapy. But some people may have this damage to the lymphatic system and a system that's overloaded at the same time. And what we have to do is try and balance the two out and try and look at things that might be causing an extra load on our lymphatic system and balance that with making what's left of our lymphatic system work better. But in the main, we have to load the system. Number one, load it, and it'll generally take care of itself. There are three types of lymphedema, and I'm leading up to how we measure that in a minute. First of all, the early lymphedema is generally fluid. Okay? In other words, you put your hand up in the air and the fluid goes away. We now can do that. It doesn't go away quickly, but if we leave our hand up in the air for 1 hour or 3 hours or 4 hours, most of that fluid goes away. And Ivona did that way back in 1973, didn't you? On there, it goes away quicker. If you elevate your hand and you've got compression and you move your arm, it goes away even quicker still. That's fluid. But if lymphedema stays around for a longer time, it becomes fatty and then it becomes fibrous-y. In other words, what I'd like you to do, if you want to get a feeling of what that's like, when I squeeze my tissue here, this might be different from when I squeeze my tissue here on the other arm. And that's a measure of how much fat there is in the tissues. And lymphedema, generally, if it's around for a fair while, will get a little bit fatter, a little bit more fat on the surface tissue. Now, when you're squeezing, just squeeze gently. And remember that you might squeeze here and find no difference, and you squeeze over here and you'll find a difference. That's because there are different drainage areas. Just keep that in mind. So when you're measuring this, you can see how much fat you've got there. So that's a measure of how your lymphedema is progressing and the difference between different parts of your arm or different parts of your leg. Just remember, each territory can behave differently. You can see some pictures here of the fat build-up. You can see some pictures here of the fibre build-up. And what I'll talk about in a minute is about measuring these things. Can you see this is a vessel here? This is where all the waste, the lymph has to go along. Can you see the stuff here? When you've got lots of fibre in the tissue, the vessels can't move. And one thing I want you to remember about the lymphatic vessels is that they're continually pumping like this all the time. Everyone's seen a jellyfish, haven't you? Yeah? Okay, jellyfish are doing this all the time. And that's what your lymphatic vessels are doing all the time. But sometimes they can't do that. And when they can't do that, what happens is they just go like this. And when they're going like this, they're not actually pumping the fluid out of them. Okay, it's like this little thing, wherever it was. Where's it gone? Helena, did you take it with you? Yeah, the sucker. Anyway, it's like the little sucker wasn't sucking properly. Okay, it's not pumping properly. So that's the very most important thing to remember. Fibre in the lymphatic system is the worst enemy. So this is important. If it's sucking properly, it goes full. It sucks up a lot of water. If it's not sucking properly, it just sucks up a little bit. So your lymphatic system's not taking the fluids away that it should take away. So fibre in the lymphatic system is the worst enemy. So we've got to stop the development of the fibre in the tissues. Now, so we've got a picture. We've got a swollen limb. Some of the limbs are going to be fluid, some of them are going to be a bit fatty, and some of them are going to be a bit fatty and a bit fibrous-y. And what we've got to do is know where they are on that scale, because once we know